little bit left, just to make sure everything's nice and symmetric. Although classically the lower lips should be fuller than the upper lips, a lot of younger women these days will like both lips to be the same size, or sometimes even have a little fuller upper lip. It's more of a youthful look. Now I evaluate how they look. I go back. There's very little bleeding. These little punctate bleeding sites are completely normal. The lips are extremely vascular. You expect nothing less. Again, she's not feeling any of this, so I can take my time and make sure everything is nice and symmetric the way I want it to be. When I massage, I also feel with my fingers the amount of fullness of substance, whether it's Juvederm or Restylane. And by doing so, what I can do is determine if I am symmetric, if I need more on one side. If there's a little bleeding, I hold pressure and minimizes the risk of bruising. And the lower lips look good. We're just going to contour the upper lips. Now I'm going at the vermilion border, which is the zone between the white and the red lip. This gives her the projection that we need. We're done with the injections. Now what I'm going to do is gently massage it. Make sure there's no lumps or bumps or any nodules. You never want to send any patients home with lumps or bumps or nodules. You want to just massage it for them here. And we're done. Now her lips are numb, so she will not be able to have great control of them. I usually tell them to avoid any kind of drinking or eating for a couple of hours after the injection. But this pretty much concludes our injection of Juvederm to the lips. And it's a procedure that most patients repeat twice a year. It takes about 10 to 15 minutes to do the whole procedure. And the cost depends on the filler. It can be somewhere between $600 to $700. It depends on how many syringes patients use. Most patients use one syringe. I do have some patients that require more than one syringe, and obviously the cost goes up from there. But there's really no better alternative as far as a permanent filler for the lips. There are longer lasting fillers, but they don't belong into the lips. They're not safe for the lips. They can cause nodules and lumps and bumps that then have to be excised. So the options are either implants or safe fillers like Juvederm and Restylane. Thank you.